Sound safety procedures are an important part of all salon ecology programs. That makes it important for you to understand simple first aid procedures, like the emergency care of cuts, minor burns, and eye injuries. To treat bleeding and wounds, first place a clean cloth or gauze and gloved hand over the wound. Apply firm, steady pressure for at least 5 minutes. Next, call 911 or other emergency personnel if bleeding is severe. If practical, elevate an injured arm or leg above the level of the victim's heart. After bleeding stops, secure the cloth with a bandage. Do not lift the cloth from the wound to check if bleeding has stopped, and be sure the bandage is not too tight to avoid cutting off circulation. Never use a tourniquet unless bleeding is uncontrollable. A tourniquet may result in subsequent medical amputation. Knowing how to give aid to someone choking can truly be life-saving. First, determine if the victim can speak or cough. If the victim can speak, do not interfere with the victim's attempts to cough the obstruction from his or her throat. If the victim cannot speak or get sufficient air, have someone call 911 while you perform abdominal thrusts. Stand behind the victim and wrap your arms around his or her stomach. Next, make a thumbless fist with one hand and place that fist just above the navel and well below the ribs with the thumb and forefinger side toward the victim. Now grasp this fist with your other hand and perform an upward thrust, pulling it quickly toward you with an inward and slightly upward movement. Repeat if necessary until the object is dislodged. Refer to your textbook for guidelines associated with fainting and eye injuries. Your understanding and implementation of infection control and safety measures provides the working environment needed for a healthy, safe, and successful salon career.